faithfully delivering value by interpreting great books from around the world.
Hello, this is Sally's Book Talk.
Today, we're going to interpret the book called The History of Public Health for you. The author is George Rosen, a pioneer in medical social history and an American medical historian. In early 2020, the COVID-19 pandemic swept across the globe. By September 2021, global confirmed cases hit about 230 million, with around 4.72 million deaths. That,
Oh, the speed and spread of the pandemic were truly shocking.
of course, humanity ain't facing this for the first time. Thousands of years of civilization have been a history intertwined with diseases. In the mid 14th century, the Black Death swept Europe, killing one-third of the population. Then, in the 17th and 18th centuries, in Europe, about 1,000 people died daily from diseases like smallpox, leprosy, yellow fever, flu, and syphilis. All terrifying infectious diseases back then. It wasn't until modern times, with advances in medicine and the setup of public health systems, that things slowly got better. The author of The History of Public Health we're discussing today outlines its development with solid data and clear writing. This book is also hailed as a groundbreaking work in public health history. The whole book has 8 chapters and 410,000 words, mainly covering public health history in the Western world. Note that it was published in 1958 and lacks info on later events, so I'll add some data to give a fuller picture of public health history. Next, I'll split this into 2 parts, using the mid-1800th century as the dividing line. Why pick this time point? Because before that, humans handled public health issues mostly through religious customs and experience, with lots of irrational stuff. It wasn't till the mid-1800th century, when the French Enlightenment kicked in, that we started using science to study diseases and their spread, slowly forming the modern public health system. The author sees the mid-18th century as a watershed in public health history. All right, now for the first part, public health activities before the 18th century. First, we gotta understand what public health is. Modern public health covers a wide range, including preventing, monitoring, and treating major diseases, especially infectious ones. It also involves managing urban and rural sanitation, overseeing food and drug production and distribution, plus health education and promotion. From this perspective, pre-18th century public health activities mainly involved 2 aspects. First, managing urban sanitation environments. The other was preventing infectious diseases. Let's start with managing urban sanitation environments. The key focus here was constructing and improving water supply and drainage systems. Archaeological findings show that during Egypt's Middle Kingdom period, 4,000 years ago, people already built brick and stone drainage channels in cities. Civilizations in the Aegean region like Crete and Mycenae also valued domestic water supply.
Palaces on Crete not only had baths, but even flushing devices for toilets.
Similarly, archaeologists have discovered extensive water facilities in ancient ruins across the Middle East, India, China, and the Americas. But the pinnacle was achieved by ancient Romans with their aqueducts, the most advanced water system of antiquity. You can think of an aqueduct as a water-delivering bridge, one end connected to mountain springs kilometers away, the other to city reservoirs, built on gradual slopes, so water flowed through channels into storage. Midway and endpoint settling tanks removed debris. After reservoir storage, pipes distributed water to shops, public baths, and homes. At its peak, Rome had over 10 aqueducts moving 570,000 liters daily for 1 million people. Truly an ancient marvel. Romans also spread aqueducts throughout their territories. Today, from Spain to Syria, over 200 Roman aqueduct ruins remain scattered. Why did ancients value water so much? It connected to the concept of maintaining personal cleanliness. Many primal religions required followers to keep themselves and surroundings clean to appear pure before gods. For example, Inca society held annual September ceremonies praying for divine protection. Participants bathed, changed clothes, cleaned homes, and offered spotless sacrifices. Ancient Romans similarly required cleanliness for their frequent religious rituals. Plus, Romans loved public gatherings, political forums, theaters, plays, all demanding tidy appearances as basic etiquette. Thus, clean water became essential for Romans. So, where did all that used water go? The Romans thought of this too. Their cities usually had drainage ditches with dedicated personnel for regular maintenance and cleaning. As early as the 6th century BC, the Romans built the Cloaca Maxima, which was 3.6 meters high and 3 meters wide. It drained all the city's sewage into the Tiber River and could harness rainwater's force during storms. Cleaning the pipes essentially gave them self-cleaning capabilities. To this day, the Cloaca Maxima remains part of Rome's drainage system. The advanced water system had an extra benefit, keeping Romans in a cleaner environment, reducing disease spread. In contrast, medieval cities weren't so lucky. In the 5th century AD, the fall of the Roman Empire caused a huge drop in Europe's administrative abilities. In former Roman provinces like today's France, England, and Spain, many towns were destroyed. Public environments worsened badly, creating medieval cities' key traits: overcrowding and filth. Looking around, houses were packed tight, streets crowded, though they were mostly muddy pads. There was no water system. Residents fetched river water or dug wells, dumping wastewater right outside. Many residents kept poultry too, and their feces were tossed onto streets with no cleanup. Some cities were so dirty that when wind blew, dust mixed with garbage flew everywhere, making it hard to move. It wasn't until the 12th century, with stability and more income, that some cities could improve public health environments. For example, in 1185, Paris paved roads and required large homes to have underground toilet pipes for waste discharge into rivers. This move somewhat improved Paris's muddy roads and foul smells. Cities like London, Prague, and Milan followed suit. Of course, a proper water and drainage system was still a luxury. So overall, medieval city sanitation was worse than Rome's era, and real changes had to wait for the Industrial Revolution. Now, let's talk about another main aspect of public health activities before the 18th century: preventing and controlling infectious diseases. Since humanity began, diseases have been constant, especially infectious ones, because they spread fast between people, posing a serious threat to society. According to the ancient Greek historian Thucydides, in 430 BC, Athens was struck by plague. Healthy, robust people suddenly developed high fevers, their eyes turning bloodshot, with violent coughing. As the illness worsened, patients convulsed, vomiting and having diarrhea constantly until death. The plague killed half of Athens' population, leaving the entire city-state in fear and sorrow. Malaria also tormented the Greeks at that time. Malaria cases were everywhere in the writings of the ancient Greek physician Hippocrates. Having seen so many cases, Hippocrates developed prevention methods. Observing malaria peaked in humid springs and hot summers, showing its seasonal nature.
So when spring and summer arrived, doctors needed to be alert.
Moreover, malaria was more common in swampy areas, showing its connection to human living environments. Thus, preventing malaria required improving swamps or relocating residents, arguably the earliest public health advice for disease control. Of course, limited by knowledge and medical capabilities then. Hippocrates mainly drew conclusions from observing past cases and reasoning, not yet scientific research. But the author believes this was progressive compared to widespread ancient beliefs in prayers or witchcraft for cures. Romans fully adopted Hippocrates' theories and created an early public healthcare system. In 16 AD, to better fight infectious diseases, Emperor Antoninus ordered doctors dispatched to Italian towns, 10 for large cities, 7 for medium, 5 for small. all called chief physicians handling local outbreaks. Seeing good results, this spread to other imperial regions like today's France, Spain, and England. Romans made another contribution too, building hospitals. Archaeologists found hospital ruins in Pompeii, proving the Roman Empire had professional medical institutions. Galen, Rome's most renowned physician, even wrote that some provinces allocated funds to establish public hospitals treating common people. This moved beyond simple disease control to providing public medical services. It must be said that in public health, Romans reached ancient society's peak, and in providing public health care, they acted quite modernly. Sadly, due to backward medical standards, plagues still broke out periodically. In 125 AD, plague struck North Africa under Roman rule, killing over 200,000 people. From 164 to 180 AD, the entire Roman Empire was engulfed by plague. Rome alone lost 30% of its population. Modern medical historians believe Romans suffered mainly from three plagues: exogenous typhus, bubonic plague, and smallpox. Additionally, there were diphtheria, malaria, dysentery, tuberculosis, pleurisy, and others. Many diseases easily treatable today were deadly in Roman times. Medieval times saw no improvement. Things actually got worse for a while. Starting in the 6th century, leprosy spread widely across Europe. Patients first developed dark red skin patches. As it worsened, eyebrows and hair fell out. Lips and ears swelled, even limbs deformed. Modern medicine has identified leprosy's cause and mastered treatments. But to medieval people, lepers got this awful disease by misbehaving and angering God. Leprosy cases dropped sharply in the late Middle Ages. Ironically, not due to better medicine, but because many lepers died in another plague, the Black Death. The plague likely originated in Central Asia's steppes.
Spreading west through Mongol campaigns, it reached the Black Sea by spring 1346. Then Constantinople, Venice, Marseille, Barcelona. In just 6 years, it killed 25 million, 1/3 of Europe.
Since even top doctors were helpless, people saw it as divine punishment too. Still, medieval times made some public health advances. As they say, long illness makes a doctor. They developed measures, one lasting till today: quarantine. Medieval doctors realized both leprosy and plague were contagious, spreading through touch or droplets. Without effective drugs, the best solution was isolating patients. By the early 13th century, Europe had about 19,000 leprosariums for isolating lepers. After the Black Death, Venice and Milan created special zones requiring 14-day quarantines for newcomers before city entry. Oh, the spread of the Black Death made people realize hospitals' importance. They isolated patients while providing care for recovery. Some cities funded hospitals with doctors paid by municipal governments, the predecessors of modern public hospitals. By the 15th century, big cities like Paris, Amiens, and Florence had dozens of hospitals, while England alone had over 700. But even with this awareness, medieval folks still couldn't pinpoint causes or treat effectively, leaving many diseases uncontrolled. And take smallpox. It existed since antiquity, hitting the Roman Empire. Chinese records also documented affecting Qing dynasty emperors. Both emperors Shunji and Kangxi contracted it. As Europeans reached America, Asia, and Africa, forming global trade networks, smallpox spread, multiplied. In the 16th century, smallpox first ravaged Spanish-American colonies, killing tens of thousands of Native Americans before returning to Europe with devastating impact. Smallpox spreads through air. Once infected, there's basically no cure. Europeans tried bloodletting, mouse-infused wine, vomiting, all useless. Patients either died or recovered naturally, giving smallpox terrifying fatality rates, 20% minimum, up to 60%. Of course, proper water and drainage systems remained a luxury. So, overall medieval sanitation lagged behind Rome's era, with real change awaiting the Industrial Revolution. Now, let's discuss another key aspect of pre 18th century public health activities controlling infectious diseases. They've shadowed humanity since birth, especially contagious ones spreading rapidly between people, threatening societies. According to ancient Greek historian Thucydides, plague struck Athens in 3030 BC. Demonstration clinical description healthy, strong people suddenly got high fevers, bloodshot eyes, and violent coughs. As it worsened, patients convulsed with constant vomiting and diarrhea until death. The plague killed half of Athens' population, engulfing the city-state in fear and grief. Malaria also tormented Greeks back then. Malaria cases fill the writings of ancient Greek physician Hippocrates. Having seen so many, Hippocrates developed prevention methods, noting malaria peaked in humid springs and hot summers, showing its seasonal pattern. So whenever spring and summer roll around, doctors gotta be on alert. Plus, malaria is way more common in swampy areas, which shows it's tied to where people live. So, to prevent malaria, you gotta fix up the swamp's environment or just move folks out. Kind of the earliest public health tip for fighting infectious diseases. Of course, they were stuck with the knowledge and medical tools of their time. Hippocrates mostly figured things out by looking at past cases and reasoning, not exactly scientific research yet. But the book's author thinks that's way more progressive than relying on prayers or magic like ancient societies did. The Romans totally embraced Hippocrates' ideas and set up an early public healthcare system. That was in 160 AD. Emperor Antoninus ordered doctors sent to Italian towns, 10 for big cities, 7 for medium ones, 5 for small, all called chief physicians to handle local outbreaks. Since it worked well, it spread to other parts of the empire like today's France, Spain, and England. And Romans made another big move too, building hospitals. Archaeologists dug up hospital ruins in Pompeii, proving the Roman Empire had professional medical setups. Galen, Rome's top medical guy, even wrote that some provinces allocated funds to set up public hospitals treating regular folks, which went beyond just fighting infections to offering public medical services. And then I think, gotta say, in public health, Romans hit the peak of ancient times, and in giving healthcare to the public, they were pretty modern. Sadly, with lousy medical know-how, plagues still popped up now and then. In 125 AD, a plague hit North Africa under Roman rule, killing over 200,000 people. From 164 to 180 AD, the whole Roman Empire was under plague. Rome alone lost 30% of its people. Modern medical historians figure Romans suffered from 3 main plagues: exogenous typhus, bubonic plague, and smallpox. On top of that, there was diphtheria, malaria, dysentery, tuberculosis, pleurisy, and more. Plenty of diseases that are easy to treat today were deadly back in Roman times. The Middle Ages saw no improvement. In fact, things got worse at times. From the 6th century onward, leprosy spread widely across Europe. The patients first developed dark red skin patches. As it progressed, eyebrows and hair fell out, lips and ears swelled, even limbs deformed. Modern medicine has identified leprosy's cause and developed treatments. But medieval people believed lepers got this awful disease by misbehaving and angering God. Leprosy cases dropped sharply in the late Middle Ages. Ironically, not due to better medicine, but because many lepers died in another plague, the Black Death. The plague likely originated in Central Asia's steppes. Spreading west through Mongol campaigns, it reached the Black Sea by spring 1346, then Constantinople, Venice, Marseille, Barcelona. In just 6 years, it killed 25 million, 1/3 of Europe. Since even top doctors were helpless, people saw it as divine punishment. Still, medieval times made public health advances. Long illness makes a doctor. They developed measures like quarantine, still used today. Medieval doctors realized both leprosy and plague were contagious, spreading through touch or droplets. Without effective drugs, isolating patients was the best solution. By the early 13th century, Europe had about 19,000 leprosariums for isolating lepers. After the Black Death, Venice and Milan required 14-day quarantines for newcomers before city entry. The Black Death's spread highlighted hospitals' importance. They isolated patients while providing care. Some cities funded hospitals with municipally paid doctors, precursors to modern public hospitals. By the 15th century, Paris, Amiens, Florence had dozens of hospitals. England alone had over 700. But even with this awareness, medieval people couldn't identify causes or treat effectively, leaving diseases uncontrolled.
Take smallpox, for example. It's been around since ancient times, hitting the Roman Empire. Chinese records also document it affecting Qing dynasty emperors.
Both Emperor Shunzi and King Shi contracted it. As Europeans reached America, Asia, and Africa, forming global trade networks, smallpox spread, multiplied. Over time, workers' residential areas became slums. From London and Manchester in the UK, to Rouen and Lille in France, to Munich and Dresden in Germany, every industrial hub had workers' slums. Here, typhoid, cholera, and tuberculosis ran rampant. A survey in the early 1830s showed half of slum children didn't live to age 5, and those surviving to adulthood averaged just 40 years. This situation sparked widespread sympathy. French symbolist poet Baudelaire wrote, "Whatever your party, seeing these sickly people breathing factory dust, bodies soaked in white lead, mercury, and poison, sleeping in flea-ridden beds, how can you remain unmoved?" A visionary took action. British social reformer and public health movement pioneer Edwin Chadwick. Growing up in Manchester, he knew slums intimately. He'd served as secretary to philosopher Jeremy Bentham, deeply influenced by utilitarian ideals. Bentham argued social policies should maximize collective happiness. Yet, mid-19th century British cities were 70% workers. How could greatest happiness exist when they suffered so terribly? Chadwick believed change was imperative. His advocacy launched Britain's public health movement, contributing in two key ways. First, using statistical surveys to analyze public health issues. From the 1830s, under Chadwick's leadership, sociologists conducted detailed surveys of British living conditions. One survey revealed rural death rates at 18.2 per thousand, 1831 to 1839, while cities hit 26.2 per thousand, shockingly higher urban mortality. Sociologists blamed dense populations, terrible sanitation, and disease outbreaks. But was this truly the cause? Chadwick's surveys showed that in communities with poor sanitation like slums, the death rate from infectious diseases hit 40 per thousand, far higher than elsewhere, proving disease is indeed tied to environment. Given the effectiveness of survey methods, they became essential tools for shaping public health policies. And the public health movement's second contribution, advancing public health through legislation, establishing specialized agencies to manage it.
Driven by Chadwick, the UK Parliament passed the 1833 Factory Act, setting clear rules on factories, environment, worker treatment, and hours to protect labor rights.
In 1834, Parliament passed the Poor Law Amendment Act, aiming to improve sanitation by reducing poverty. Because Chadwick believed disease rates and poverty were closely linked. Simply put, the poor get sick easier than the rich. So just fixing sanitation treats symptoms, not the root cause. More crucially, lifting workers out of poverty lets them improve living standards and hygiene. In 1848, the UK Parliament passed the Public Health Act, its first legislation specifically for public health. This act defined the government's responsibility for public health. Chadwick thus created the UK General Board of Health to manage national health affairs. In 1855, he assessed Paris's public health and helped establish the French Public Health Association. Afterward, similar organizations emerged across Europe and America as the movement sparked huge responses. And meanwhile, Chadwick faced fierce opposition at home.
Because everything he advocated, like better worker treatment and improved conditions,
was seen by industrialists as only raising costs and hurting profits, so they fiercely resisted.
Amid rising criticism, Parliament abolished the General Board of Health, forcing Chadwick out of politics. Yet, the tide of history was unstoppable. On one hand, worker movements surged across late 19th century Europe, forcing governments to address labor rights. On the other, industrialization and global trade boomed, spiking labor demand, requiring population growth to sustain it. But with workers trapped in terrible conditions, high injury and death rates hurt long-term economic growth. Conversely, increasing workers' income boosts consumption, enriches markets, improves community environments, and makes cities cleaner. These combined factors led more people to accept Chadwick's views. In 1873, German Chancellor Bismarck established the Imperial Health Office, dedicated to improving public facilities and sanitation in major cities like Berlin and Munich. In 1883, Germany enacted the Sickness Insurance Law, followed by workers' compensation, disability, and old age insurance laws, creating the world's first social security system. Soon, Austria, Hungary, Norway, Switzerland, and others built their own social security systems based on this model, with UK, France, and US also drawing lessons. By the early 20th century, Western countries had widely established public health systems based on social security. Looking back, the 18th century French Enlightenment established principles of using reason and science to study human affairs, greatly advancing public health qualitatively. In the early 19th century, with microbiology established and artificial vaccines developed, humanity mastered ways to combat infectious diseases, elevating public health further. Simultaneously, the public health movement spurred Western nations to build comprehensive modern systems, making strides in providing health services and ensuring medical equity. However, entering the 20th century, new trends emerged in public health. As humanity entered the globalization era, any local plague outbreak could threaten other regions, making international cooperation vital. In 1902, led by the U.S., American nations founded the Pan-American Health Organization to jointly address public health issues in the Americas. In 1907, major Western nations signed the International Sanitary Convention in Rome and created the first global health body, Office International de Hygiène Publique, marking worldwide consensus on health cooperation. However, its symbolic significance outweighed practical value. Because OIHP's role was collecting and publishing epidemiological data and facilitating medical exchanges, lacking enforcement power or binding authority over members. Moreover, early 20th century turbulence, 2 world wars, and global economic crises objectively hindered international cooperation. The Spanish flu pandemic is a classic example of this. In March 1918, soldiers at a U.S. military camp showed flu symptoms. Initially, the military thought it was just regular flu and didn't take it seriously. Some soldiers were still sent to fight in Europe. By that fall, Britain, France, Spain, and others all had outbreaks, with Spain hit worst, about 8 million infected. Even the king caught it, so this U.S.-originated flu was mistakenly called Spanish flu by media. With WWN ending, European powers had neither resources nor experience to respond, leading to near chaos. Conservative estimates say by March 1920, Spanish flu killed 50 million, 5 times more than World War I soldier deaths. This painful lesson made people realize the urgency of international cooperation.
Yet the process was full of twists. In 1923, the League of Nations established a health organization to fight global epidemics. It successfully combated plague and cholera in Southeast Asia.
But the League's weak global standing limited its health organization's impact.
In the 1930s, the U.S.-originated financial crisis spread globally, causing factory closures, bank failures, soaring unemployment, and rising tensions.
World War II finally erupted in 1939. Plummeting economies reduced living standards. War destroyed sanitation infrastructure. All this made international health cooperation extremely difficult, dealing a heavy blow to public health. And by World War II's end, multiple infectious diseases resurged, alarming experts. So when allies planned the UN, proposals for a global health body got strong support. In 1946, the UN adopted the WHO Constitution, establishing the World Health Organization to coordinate international health work, control epidemics, and support needy regions. Its crowning achievement was eradicating smallpox. By the late 1950s, the US, Europe, Japan, and China had largely eliminated smallpox through vaccines, but many countries still suffered due to funding and tech shortages. According to WHO reports, over 10 million smallpox cases occurred annually across 40 or more countries then, causing about 2 million deaths. Given this, in 1958, Soviet Deputy Health Minister Zhdanov proposed at the World Health Assembly that WHO lead a global smallpox eradication effort. For this, the Soviet government offered 25 million vaccine doses yearly. The US initially showed little interest. They didn't want to cooperate with their Cold War rival. Until 1967, trapped in the Vietnam War quagmire and facing global criticism, the U.S. decided to join the USSR against smallpox to improve its image. They divided responsibilities. Soviets provided vaccines. Americans funded the effort. In 1967, WHO launched the smallpox eradication program, vaccinating globally, benefiting hundreds of millions.
On May 8, 1980, WHO officially declared smallpox eradicated.
Today, only small stocks remain in high-security labs in Russia and the U.S. for research. Smallpox remains humanity's first eradicated infectious disease and a model for international health cooperation. Today, public health involves broader scopes and deeper complexities. Beyond emergencies like Ebola or COVID-19, it includes aging populations, maternal child health, occupational diseases, and more. In our global village, solving these requires international collaboration. Finally, I'll end with the author's advice. Public health workers must expand focus beyond local or national to the global community. Today, we're interconnected. Every community must strive toward freedom from disease, poverty, and fear. We must work to inherit and advance our noble legacy. All right, that's the history of public health. We'll end our interpretation here. Reading notes are below the audio. See you next time.